Hi, I'm Dr. Peter Bacci, the Editor-in-Chief and founder of Pain Relief Revolution. What I want to talk to you about today is pain and where I see patients struggle and fail in their journey in trying to overcome their pain, and what I think needs to happen in order for you to have the winning formula to overcome the pain and get the relief that you want. So let's start with the pain. What does everybody in pain want? When I ask that question, almost universally, people say relief, right? Relief is what you want. So, relief is our goal. That's what we want when we're in pain. That's what we're looking for. But let me tell you what happens and where I think people start to run into problems. Logically, it makes sense that we think that because we have the pain, if we can get rid of the pain, then we can get the relief that we want and we achieve our goals. But what happens is pain is, it's complicated, and there's many factors, many pieces to it, and certainly chronic pain is a chronic disease, just like diabetes is, just like hypertension is, heart disease. These are all chronic diseases. So what happens is people start to focus on their pain, and they want to get rid of the pain because they are assured that if they can do that, then they'll get the relief that they want. And that does make sense. So what happens is we start focusing on the pain. We start focusing on what tests do we need to do to figure out the pain, what treatments do we need to do, what surgeries do we need to have, what procedures do we need to have. We focus on the pain, and our focus becomes on the pain. And we do this over and over again, day after day. And then when that doesn't work and the pain is still there, and we've had all these medical treatments and tests done and surgeries and things, then we start focusing more on, well, let's put medications. Let's add medications to try to take away the pain. Let's keep, we keep focusing on the pain. We start taking more and more medications. And I see people do that, and what happens is they don't get there. They don't get the relief that they want. The focus on the pain does not, in the end, have people feeling better. And that's where I see problems happen for the patients that I work with. What they do get, though, is what I would call suffering. They come here instead of there. Suffering is our emotional response to how we process our pain. And when we're focusing on our pain every day, and we're focusing our energies and our time on trying to make it go away, and day after day it's still there, it doesn't go away, that creates a huge emotional, psychological burden on us, and that leads us to a bad place, which is suffering. And our pain is now causing us to suffer in a deep and dark way. And I see this sort of cycle happen with patients that I work with every day. Now, I also see them get out of this, and I see them overcome that, and I see them get here. And what happens is patients start to get to a point, people start to realize that the pain may still be there. Yes, you may have the pain, but you can start to learn things that you can do to manage the pain. You can start to learn things that you can do to get yourself relief, whether it's some new stretches, some new exercises, some breathing exercises, some special meditations, some whatever the formula is for you. Once people start to realize that those things start to work for them, they start to move away from a place of suffering and start to move to a place where they start to achieve their goals, which is getting relief. And once people start to learn that, I see a lightness take over. That heaviness starts to lift and go away. So what that means is you have to be comfortable in accepting the fact that pain is there, pain does exist, it's a part of the world we live in, it's a part of the life we live, but at the same time you start to put it in a box and you recognize that it's there, but it no longer defines you, it no longer becomes your focus of all your time and energy every day, and you start to shift that focus away to, yeah, I know it's there, just like I know my back pocket is here, but at the same time I know that I can start to engage in healthy things that will help me feel better, give me relief, so that I have the life that I want, and so that I have control over my pain and my